We went to the Welsh Ambulance Service and we said, why don't we work together, and what can we do to ease the pressure that you're under? As a health board, I guess, we recognised that our emergency departments and our ambulance services are under ever increasing pressure, and we asked ourselves as community clinicians, what can we do to try and improve that? And the Clinical Navigation Hub really started to come into its own sort of early last year, and that's certainly when I got involved with it. We started initially by looking at those patients in our emergency departments and trying to maybe pick off those that would be suitable for us to manage remotely over the phone. And while we had good success with that, we felt that there was more that having a GP based in our call centre every day could do.
So what's your role in that then, Dewi?
So my role is, so at the moment we have 2 GPs in working in the Clinical Navigation Hub each day. One is based in our call centre and one is out on the road in a fully equipped car doing home visits for patients who maybe can't come to see us. And after our initial kind of trial with our emergency departments, we then decided to allow our local nursing homes to be able to pick up the phone and contact us. And so we contacted them and we said, in patients that you would maybe usually call an ambulance for, providing there is no immediate threat to that patient's life, why not give us a call in the Navigation Hub instead and see if there's something that we can do for those patients? And so we're able to triage those patients over the phone, and then very frequently we'll go out and see those patients and try and successfully keep them at home in their care home where essentially they want to be and their families want them to be. Because we know these patients, these frail elderly patients, when they get to the front door of the hospital, they're very difficult to be able to turn around and get back home that same day. And quite often them going into hospital results in a prolonged admission for that patient, which isn't good for their overall health. And actually then, by the time they do come back home, their baseline is a lot lower than it normally would be, and their health has declined as a result of a long admission, despite everything we try and do for them in hospital.
You've mentioned obviously about the ambulance aspect to this, and you worked in collaboration with the Welsh Ambulance Service NHS Trust. Can you tell us a little bit about their role and why it was so important that you worked together on this?
Yeah, absolutely. So, as I alluded to at the start, we've got significant waits for ambulances at the moment because of the pressures our NHS are under. And so we went to the Welsh Ambulance Service and we said, why don't we work together, and what can we do to ease the pressure that you're under? And so what they've done is they've given us access to the list of patients who are currently waiting for an ambulance. So we've got a live, up-to-date list of all those patients that have called 999 in our area. And we can look at that list and maybe pick off the ones that maybe we think we can manage appropriately without the need for an ambulance. And so what I do as the triaging GP at our call centre is I look at that list and I say, oh, that patient might be suitable to be managed at home. And I'll go into that call and I'll triage that patient and make sure that it is safe for us to do that. And if necessary, so a typical example of this would be, say, an elderly patient who's got COPD, maybe they think they've got a chest infection and they're a bit more breathless. And they ring 999 because they're worried about their breathing.
Yeah.
And I pick that case off the ambulance stack. I speak to that patient. I assess that actually they're stable at the moment and they don't immediately need an ambulance. It's not an immediate threat to life. And so I can dispatch our home visiting GP, who will go out usually within an hour and see that patient, do a full clinical assessment. And if this is a chest infection and the patient can be safely managed at home with antibiotics, we can issue those there and then, and that patient gets their antibiotics and they stay at home, and then we can then cancel that ambulance, preventing an ambulance attendance, preventing a conveyance into hospital, and the patient is happier as a result of that as well. And we are seeing huge successes with what we're doing. Around 80 to 90% of the calls we get from nursing homes, we're managing to avoid an admission in these patients, and we're keeping them at home and managing them safely and again, where they want to be. I presented this data to our exec board back in October, actually, and told them about the month of October. And in the navigation hub, we had 132 calls from nursing homes. And of that 132, only one patient ended up being admitted. We kept the other patients at home.
Wow.
And that is a huge figure. That's a huge success. And it's not only going to mean better care for those patients, it's also taking the pressure off our emergency departments and our ambulance services. That's 131 other ambulances that maybe didn't need to go to those residents because we've managed to treat them and keep them at home.